Hello, I'm Sasha Nicole, and joining us today is Nathan Koranda, the Executive Director and co-founder of Kopi Medical. The mission of Kopi is to include mental health care training in emergency medicine, both in Tanzania and in Minnesota. Their model serves to equip police officers to assist in emergency response, as emergency responders are not always available to meet demand in Tanzania. Given that mental health is just as vital to physical health, Kopi offers a holistic approach wherein responders are trained not only to address physical and visible wounds, but to help the community members recognize mental health issues that need to be worked through as well. Kopi Medical is one of Emanate International's first partners to have a foot both in a developing country as well as the United States. I'm sure you will find the impacts of this work to be very inspiring. So, thank you for being here, Nathan. How are you today?
I'm good, and I'm happy to be here. Thank you for having me.
Good.
Yeah,
Thank you. Yeah. So tell us, tell us a little bit about your background and how you came to found this organization.
Yeah, so I started my career out in medicine as a paramedic. I worked here in the city of Minneapolis for roughly 6 years, and it was the mental health component of that job that was most important to me, or is what I found to be most interesting. And I had already been involved in advocacy work around the opioid epidemic and addiction at that point as well. So returned to school, became a registered nurse, and have worked in child and adolescent psychiatry for the last 3.5 years, and currently involved in a Doctor of Nursing practice program at the University of Minnesota with a focus in psychiatry. So I'll be a psychiatric mental health nurse practitioner when I'm done.
Okay.
So in between, opportunity to meet Dr. Mabula, who's a physician with Arusha Lutheran Medical Center. So he works out in Arusha, Tanzania. Came up to do a ride along on one of our ambulances, and then just through serendipity, we got involved with him, and that's really where the Arusha project started.
Got it. So let me understand. So this doctor from Tanzania came to Minneapolis to learn about your process here, and then you two formed a connection, and that's how you got linked to Tanzania. Did I understand that right?
Yeah, that's you understand it perfectly. That's
Okay.
exactly what happened. So he had been working with Dr. Stephen Dunlop, who's an emergency medicine physician at Hennepin County Medical Center. And so those two had a long-standing relationship for over a decade at that point. Dr. Dunlop is the chairman of our board.
So okay, in Minneapolis.
Minneapolis.
Okay.
Yeah.
Excellent. So tell us a little bit about, I understand that Kopi offers 3 different programs, and you just mentioned Arusha, which is one of them. Maybe we'll start with that. So tell us a little bit about Arusha, what that is, and and I'll ask some follow-up questions based on that.
Yeah, so we look at physical trauma, or globally physical trauma, as sort of the neglected tropical disease. So, it takes more lives than TB, malaria, and some of the other neglected tropical diseases combined, but only receives about 1% of the global funding and support in order to address it. Arusha is not different in that way. They're struggling right now, specifically with like road traffic injuries, which is the leading cause of death. And one of the interventions that the World Health Organization has identified as being a crucial component is pre-hospital emergency medicine. And currently, they don't have an established pre-hospital emergency medicine response, so no paramedics. So you're looking at a region that is larger in population than the Twin Cities without any ambulances on the road. And I think we all could probably, without even being there, understand the significance of something like that. And so Dr. Mbula came up with this idea, which is new to Tanzania, so never been done in Tanzania, but has been done in other areas of the world, which is leveraging, the power of the police and lay people in order to fill a void.
Right.
So he asked us to come and train police officers in, basic first aid, and we've been doing that on and off for the last 3 years.
Okay. I'm just a little curious because I know in different countries things operate differently. Are police officers paid by the state in Tanzania, or do they have kind of a stable work environment? I'm a little curious how that impacts things.
Yeah, they do have a stable work environment. They are paid.
Yeah,
So it's an established workforce already.
sure.
So,
Okay.
it's their 9 to 5, for lack of a better way to say it. I know
Okay.
they're working, far more than 40 hours a week
Mm-hmm.
down there. They're out on the street, and in actuality, they're already really responding, or are the first ones on scene when there is a road traffic injury.
Mm-hmm.
What we're providing is the professional development or education so that they can do it in a way that's, appropriate and effective.
Right. So the infrastructure is in place. So they sound like kind of the ideal network right there to train and equip to go ahead and address that. Okay, that makes sense.
Exactly. Yeah.
Yeah. You've touched on this a little bit, but what are some of the barriers to medical care that you've seen in your work, and specifically in Tanzania?
Yeah. Infrastructure is a huge piece of it.
Yep.
The roads are, often unpaved, they're crowded, there's a lack of, traffic lights from, and, speeding, motorcycles, and just a young population as
Mm-hmm.
well. So, funding and resources is another issue that can be, a barrier.
Mm-hmm.
So, one of the things that we're working on right now is not just providing education, but, starting conversations and essentially doing, advocacy work, for lack of a better word, to try to get more buy-in from, the local police leadership to, give them the supplies that they need in order to leverage some of the skills that we're teaching them how to use. So,
Yeah. And then how did mental health care become part of this program, and what areas do you see that are in great need in terms of
yeah, that's a really good question. So, we went down there the first time, and the first time we provided some education, it was more just generally speaking about what pre-hospital emergency medicine looks like in the West, right?
Mm-hmm.
We came back, we talked about what went well, what could be improved, and one of the conversations, or one of the things that came up, was mental health. Here in the United States, it's under addressed for sure.
Mm-hmm.
And so, we sort of had this idea in our head that if we were going to create a training program, that we should do it in a best practice sort of way, and that would be to include some education on, post-traumatic stress disorder, and do it in a culturally competent way, right? So, not just walking over there and assuming that Western mental health care is going to be the best for the people we're training, but just starting to have a conversation. So using, World Health Organization guidelines, partnering with a local psychologist, and developing a mental health curriculum that really just sort of puts context around the experience. And what we learned the first time that we rolled that program out was that the divide really isn't that great. They're asking questions of us, along the lines of, why am I drinking so much? Why am I having difficulty with my wife? Why can't I sleep for a week after I see, somebody who's died on scene? And, one of the biggest things that we came across anecdotally is this idea that their colleagues aren't responding to some of these calls just due to the, mental and emotional trauma that they're experiencing, which is significant because that's a barrier to care, right? And so we can give them training and material all day long, but if, the psychological impact is preventing them from going in the first place, then what's the point? So you really have to address, I believe, both of those things in concert, right? Giving them the skills that they need and providing them with emotional and mental strength and resiliency in order to meet the demands of that job.
Absolutely. No, I think that's crucial. And I think that's the difference between a Band-Aid versus real healing, is when you can take that holistic approach that you have, because you have the visceral, you have the physical ailments, but there's a lot more under the scenes that we don't always see. So I'm just a little curious, culturally, do you have an example of, an approach that would be different in Tanzania than maybe here in terms of how you either instruct that or things that you might discuss?
Yeah, I mean, I think some really basic stuff is using local interpretation. So having Dr. Joshi, who's the lead psychologist out there, be upfront and present in that. Understanding what resources are available locally in order to, if we're going to talk about something, making sure that we have, a direct line to something, some sort of care, if they're going to bring it up. Not getting involved in treatment per se, right? So I believe that it would be irresponsible for us to go in there and start saying we're going to treat the mental health of police given the time that we have, right? But opening up room or space to have a conversation if they want to have that conversation. And that sort of treads into some of the World Health Organization guidelines about how to respond to trauma
Right.
after the fact. There's a great sense of community out there, and from my lens, a greater sense of community than there is here per se. And so there's more of a willingness to maybe have a peer-to-peer approach than there is, here. And so, we're exploring, I guess, ways to, maybe build some interventions that would be appropriate out there, understanding that there's a lack of established, mental health treatment. And I think that peer-to-peer support might be, a piece of that, but it's still relatively new and we're still learning. And I think the thing that we can do that's the absolute most culturally competent is listen more than speak.
Yes. Yep. In all the interviews I do, that's a common thread. The importance of really listening and not coming in with your own ideas of how things should be, but really hearing the people because they have way better ideas than we do, quite honestly. They know their culture, they know their home, they know their community. So what are your goals for the Arusha project?
Yeah. So, I mean, we hope, with our partners on the ground to create, a sustainable model that, won't just operate well there, but also, could potentially be utilized elsewhere. And, I think, that's going to involve the development of, a plan that spans years, quite honestly. But, if I were to dream a dream along with the people down there, it would be, having an academy or some sort of a training program that lived there, did not require me, and, had some of these other elements incorporated in it. So, having that mental health, piece of it, having the emergency medicine piece of it, and then having an electronic way that we could evaluate the impact. And those would really be that, that sort of 3-component sort of model where you would have, we're responding to emergencies, we're supporting our first responders, and we're seeing what we're doing.
And did I hear you say ultimately you would like locals to be assuming most of the work too, that you'd like to kind of make yourself either less necessary or perhaps obsolete altogether? Did I hear a little bit of that in there?
Yeah, obsolete altogether would be the goal, not because I don't want to be there, but because it's a responsible thing to do, right? I mean, me being there, once or twice a year, or even providing remote support, I'd be happy to do that for the rest of my life just because I enjoy the people and I enjoy doing it, but that's not what should be the goal. And if it's going to grow, it needs to grow in ways that don't involve me. So.
And that's the ideal, which I think is hard, especially for a founder, to let go and release some of that investment and control, because this in essence is like a baby for you. And so I'm sure that's not easy to think about letting go of sometimes, but I do agree it is the best approach for the people in Tanzania ultimately. So and then a second program you have is the Minneapolis Fire Safe Station Project. So How did that get started, and what are the goals for this program, and what is Kopi's current role in the project?
Yeah. So how I got to be a paramedic, I lost a brother to a heroin overdose many
Oh,
years ago. And, I was 19 at the time, he was 21. And, one of the things that there were many reasons why I got into EMS, but
mhm.
one of the things that stood out in the back of my mind was, being able to revive somebody from an opioid overdose. And,
Mhm.
through the course of my career, I did that probably about 90 times.
Wow.
And, got involved with another great organization here in Minneapolis called the Steve Rumler Hope Network, which I'm currently on the board of directors on. And, they passed some really important legislation here for the state. And by way of that, I did some public speaking nationally, and I was sitting on a panel and heard about a safe station program that was in existence out east.
Mhm.
And, I wanted to bring something like that here to the city of Minneapolis. I partnered with a couple of important people, organizations, Mark Jonigan and Jordan Hansen, who work in the recovery community out here. And we presented this idea to the Minneapolis Fire Department, and it sort of took off from there. About 3 years ago, COVID, it being COVID, had stopped it up
Yep.
and started it again. But the process, or how it will work out here, is beginning in early 2022.
Mhm.
Anybody who is struggling with addiction
Mhm.
can walk into one of 3 designated fire stations and ask for help.
Mhm.
That firefighter who greets them at the door will do a medical evaluation. If they're medically stable, they'll contact Twin Cities Recovery Project, which is a BIPOC recovery community organization here in Minneapolis. A peer recovery specialist, which is somebody who has a year or more of sobriety, lived experience, and training,
Mhm.
will greet that individual, do
Mhm.
an intake, and then connect them to any number of social services or treatment services.
Mhm.
Anything from just a simple comprehensive assessment to medication assisted treatment.
Mhm.
And then Jordan, who runs Your Path Health, is working in a mobile recovery community world. So he is able to connect people, through a mobile device to some of these services as well. So that combination of having, people on the ground helping, and then also having mobile support as well, breaks down some barriers to care, and really will, I believe, and what has been shown to be true in some of the programs out east, is, getting folks connected to treatment, which is the ultimate goal.
Right.
So Kopi's role in all this, initially was helping start things up and conceptualizing. And then now we've moved into more of a program evaluation piece.
Okay.
So we'll be evaluating who we're connecting, what kind of services they're receiving, reporting monthly on the success of the program, helping guide and shape direction, and then also evaluating stigma. So some of the things that's been reported out east is that there is a decrease in stigma after these programs start. And so we're working to try to evaluate if that's actually the case,
Mhm.
and seeing if additional education might help, the fire service, or if just the sheer fact that the conversation is changing with the firefighter and the individual who's asking for help is something that impacts that as well. So
Is the stigma around mental health or around drug usage, or what is the stigma?
yeah, so we're addiction
Mhm.
specifically.
Okay.
So we're using a validated tool called the Medical Condition Regard Scale,
Mhm.
which is designed, has 11 questions that generally sort of can be used towards any stigmatized condition.
Mhm.
And in this case, we've worded it or directed it towards addiction specifically.
Mhm.
And it throws out a number from 11 to 66, 66 being the highest possible regard.
Yeah.
And so we'll give that at various time points throughout the program to
Mhm.
see what's impacting it.
Sure. So when you say stigma, is that something that prevents people from seeking help because they're afraid they're going to be perceived in a certain way? Is that?
Yeah, it can.
Okay.
And so a huge part of this program is, I called nearly every safe station program that's in existence in the nation just to do my due diligence. And one of the things that they said was most important is the way that, the person answers the door. And they need to create a welcoming environment. And so, stigma would obviously prevent that from happening.
Absolutely.
Stigma is a barrier to quality care. It's also a contributor to burnout as well. And I'll speak, this is personally for myself, but I worked as a first responder, as a paramedic in the city for a long time. And you're trained in car accidents and cardiac arrest, but the reality is what you're responding to is substance use and suicidal ideation.
Oh, sure.
And so you're not generally prepared to deal with some of those things, and it can really burn you up if you're not ready for it. And even somebody like me who had been doing advocacy work, from time to time could feel frustrated.
Sure.
And feel like you're not, doing anything, or that people aren't supporting themselves the way that they should be. And, just because of the environments and communities I was in, I was able to come back and, sort of reconcile some of those feelings and do my appropriate self-care to be able to get back out on the street in the best way possible. But that's not true for everybody.
Right.
And so, the program is, in my mind, and from where Kopi comes from, is aimed at connecting people to treatment first and foremost.
Right.
And along with that is an important number one, addressing health disparities in the city of Minneapolis. But then, also as well, trying to build relationships in the community, with first response and improve some of those relationships, hopefully through the reduction of stigma.
Yeah. So what I'm hearing kind of from what you're doing in Minneapolis as well as Tanzania is there's this overlap and there's this kind of common theme that there are barriers to care in both places, and there's some similarities when you speak about stigma or access or and then to the burnout of care of the care, those that give the care. I'm sure that definitely comes into play as well. So I think that's really important and crucial to address, and I appreciate that Kopi is addressing that because it is important.
Mhm.
So your third program is open source EPCR. Can you, tell us a little bit about, it's a technology, I understand. So tell us a little bit about what that is and, what your goals are and how it's making an impact.
Yeah. So we, one of the things in Arusha that a lot of people do have is our mobile phones. And, the network out there, while spotty from time to time, is actually fairly reliable in my experience, depending upon where you're at, right? So, the police and some of these other institutions are still using paper charting, which can make, reporting on anything very difficult. And so, our idea was to start an open sort of program that anybody can use free of charge and work towards developing that would be available, anywhere around the world. And so, I leveraged the power of a few full stack developers out of a local university here. And we built a beta version of a mobile application that would run on any device that you can download. And it would serve as an electronic patient care report. And, one of the things that I wanted them to address, and they did very well, was this idea of connectivity. And so it stores things locally on your device. And so if you were to lose internet connectivity somewhere, you would have that local storage option.
Right.
And then once you got reconnected, it would upload that back into, whatever database you were storing that information on. So, that could potentially be, a solution for reporting. It could be a way to measure some of the impact of our other programs. If we were able to get that up and running in, a very real way. At this, particular point, we have that version. We're planning next August to go down there and do some more like end user education. So, some of the barriers that I think, with this one rolling out is, there needs to be a really strong education component to it,
Yeah.
because it is a new type of technology.
Yep.
And even though it's laid out in a way that is, fairly straightforward, there still needs to be some practicing, testing, and making sure that it works appropriately before, we can call it, this is a thing that is, functioning 100%. So, like many of our programs, this is going to be, we have a long sort of arc to it, but an excellent start.
Yeah.
And, the buy-in that we need in order to begin working.
Yeah, and probably a lot of trial and error too, because when you're trying something new, it's definitely a process.
Yep.
Yeah. How do you see this technology making an impact in your sector?
Yeah, I mean, data, I love data.
Mm-hmm.
So there's lots of ways, if we were to get it up and running the way that I want to see it up and running is, could be impactful just from, being able to rapidly recognize what some of the major, issues are in that area. It would improve, patient care because there's the dashboard side of it that would, be available to the receiving hospital once we're transporting people in. So there's, access to what happened pre-hospital prior to your arrival, which improves patient care.
Right.
And just, it would reshape the way that we, model our education as well. So, just as a really simple example, if we're, seeing there's more, head injuries than, knee injuries or lacerations, then we know that we need to, aim some more of our education towards, what's happening, specifically out in that area.
Right. And what are some of the challenges to developing the app?
Yeah. So, connectivity is probably the biggest one. The the other piece of it is maintenance, right? So we're talking sustainability.
Yep.
And so at some point, the model can't be that we run every bug out here.
Yeah.
So there needs to be somebody there who has the, technological know-how to be able to take ownership of it,
Right.
work through it. And so that's where I think that one of the biggest obstacles is going to be it's not even necessarily just training people how to use it. It's we need to find somebody who has some sort of development experience or a willingness to learn it and then, manage it out there.
Yeah. Yeah. And that's, especially in Tanzania, there, not to assume, but I'm sure that there will be some education gaps that make that a little bit more challenging.
Yeah.
Yeah, I could see how that would be a barrier to reaching that ultimate goal of making yourself obsolete. So, yeah. What are the core values that drive your work at Kopi?
Yeah. Humility for
Mm,
one.
mhm.
Not walking in as though, my whatever it is that I have, credentials
Right.
or anything makes me any better than anybody else.
Mhm.
Kindness is another big one. I believe that a lot of the work that we do is really building relationships more than it is anything else.
Yep.
And I don't think you can build relationships without being kind, quite
Mm,
honestly.
Yep. Absolutely.
Determination. So understanding that things are going to take a while,
Mhm.
pushing through problems, looking for solutions,
Mhm.
and then, excellence as well. So, putting the best possible work or product out that
Mhm.
we can and, understanding that we need to do our part.
Right.
So, yep.
Yeah. Those are good values. Um, and having seen this model carried out for roughly 4 years, what can you tell us about the impacts of this approach in the field?
Yeah, we're working to get more data as far as having measurable impacts go, but we have done some initial like pre and post tests, and there have been a shift in knowledge, attitudes, and practice with the officers, out there. And just having been there, anecdotally in the last couple of years, there appears to be retention as well, which is one of the things that we're going to look at
Mhm.
the next time that we go back there.
Mhm.
But there is an eagerness to learn, a willingness to learn, and from my vantage point, there appears to be, greater, capability to do the work.
Mm-hmm.
And, I think, once we are able to measure all of that, then taking a look at what the actual health impact is going to be huge.
Yeah.
To see if we're actually making a difference there. From the mental health side of things, they're, as a perfect example, the last time that we were there, we were able to train on some, really simple measurement tools that were put into practice almost immediately.
Mm-hmm.
And we were screening for depression, and people were getting referred. So there was almost an immediate impact
Mm-hmm.
from the work that we're doing on that side.
Mm-hmm.
And, quite honestly, they keep inviting us back, which is
It's a good sign.
right? So yeah. So from that end of things,
Yeah.
that tells me that they're viewing what we're doing as being valuable to the community.
Mm-hmm.
And that's huge. That's what I look for, I think, sometimes.
Yeah.
Just, understanding that they think that we're doing what we're doing is valuable. So
Mm-hmm. Yeah, no, that says a lot if they're calling you back and wanting your participation to continue. If anyone listening wanted to support or get involved in your work, what would be the best way for them to do that?
yeah, so our website is really the kind of the biggest hub for all of that. So, if you were go to kopimedical.org, right on that front page is a donate today button. So if you wanted to provide us with financial support, that would be a good way to do it. We do sell t-shirts on Bonfire. We have a store there if you wanted to get a shirt. And then if you wanted to volunteer with us, which we're always looking for good people, that website, our website,
Mm-hmm.
has an opportunity for you to fill out a volunteer application.
Mm-hmm.
And I'd be happy to connect with anybody who's looking to do some work internationally or even locally.
What kind of, for the volunteers, what kind of things, just briefly, might you have for them?
Yeah, so education is a huge piece of it on the international side. So curriculum development, program evaluation. So some of the types of titles that we've had in the past are doctors, medical doctors on the emergency medicine side, psychiatry, social work, therapy, registered nurses. Mostly medical professionals. Tech would be another huge thing. So if you are a developer and you're looking to donate some time, that would be a good sort of place to start. And then locally here, it's mostly data.
Okay.
So, working with anybody who has, basis in research, design, methodology, and then also, analyzing as well. So.
Yeah. So let's talk about one of my favorite words, sustainability. What does that mean to you and to Kopi? How do you assess that your efforts are in fact sustainable?
Yeah, we've touched on this a little bit, and not to speak too generally, but it really is just not needing like me anymore, like a program standing on its own legs. If I look at where the Safe Station program is now, I'm fairly confident that if I were to walk away from it, it would live on and exist without me being there. That the evaluation team plays an important piece to it, but that our partners who have been fantastic, like the Minneapolis Fire Department, Jordan and Your Path and Mark Jonigan and Twin Cities Recovery Project, these people took it, they own it, and they're living it daily, and that to me says or screams sustainability. And so that's sort of the level of where I want to get to with anything that we're doing, is that it just does not require us anymore, and it's owned by the people who own it and should own it.
Excellent. And could you share a lesson or an insight that you've learned through co-founding this initiative?
Yeah, I hate to repeat myself, but it really is like it's all, to me, this is all relationships.
Yeah.
Like it's all about people. People are valuable, and I don't mean that in the way that they're a commodity. I mean that everybody has such a wealth to them, and that these projects come together and they're a success because of that combined wealth. And the best way I think to do this work is to just be a community, is to create new communities within communities, and bridge gaps between people who have knowledge and skills. And that's, what I think we do and what I think we do best.
Excellent. What change in the communities have you found to be the most impactful after they go through your program?
Yeah, I mean, I think, I'm a big mental health guy, so, that is so important to me. And, I remember being a paramedic, and some of the calls that I went on that had the greatest, maybe not so positive impact on my mental health were the ones that I did not feel I did well or did not have the skill set in order to address. Like I felt out of my depth. And, I believe in what I've seen is, by providing some education around how to manage some of these emergencies and, talking to some of the officers who are out there, one of the biggest impacts we've done is just give them the tools to feel like they're capable to respond. And that has had, a positive impact on, their general health and well-being, which is an important first step towards, helping the community.
Yeah. Is there an individual or a community that's touched you personally in your work?
And I'm sorry, an individual or community that
Has touched you personally in your work that's kind of stood out to you or has made an impact?
Yeah, there's so many of them, quite honestly. Dr. Mabula, who is an incredible individual who works out there and is our lead partner, is somebody who I have a tremendous amount of respect for because of his dedication to, the people that he works with on a daily basis. Dr. Joshi, who is another one who, one of the only psychologists in Arusha right now, but just, and something that sounds exhausting, but is tireless in her effort to, help people and treat people. These are individuals that all travel the world like, 1,000 times over to help and support, just because they're so caring, they're so kind, they're so dedicated to what they're doing,
Yeah. Where do you see Kopi Medical in the next 5 to 10 years, and what is your long-term vision?
Yeah. I in the next 5 to 10 years, I want us to continue growing. And, in the next 5 years, what I want is a measured model that can be transplanted into other areas, or at least adjusted and moved if we needed to. So I want for a perfected product, or something that a framework that we can utilize. Long-term goal, I want us to continue growing, and I want us to have, tremendous reach on multiple continents. So we're working to develop, better emergency medicine, pre-hospital emergency medicine, and incorporating mental health into that as well.
Excellent. And then if somebody, or let me reframe this, what right now does Kopi most need to advance its mission?
Yeah, I think, funding is always challenging. And, especially because of sort of the niche that we work in right now, but that, would be, I think, one of the greatest sort of, helps, I guess, for us to be able to move that initiative forward. People are pretty much a straight line across as well. So, funding and people are always the most important, things for any organization, I believe. But, we've been really lucky with the people part of it. We have had multiple individuals who have traveled with us 2-3 years in a row and have been dedicated to the mission. So, thankful for that, but being able to support their time, I think, would be huge as well for us to be successful.
Absolutely. And then if somebody did want to donate, what would be the best way for them to do that? Where could they go?
So our front page on the website does have a link there where you can donate.
Mhm.
And that, I think, is probably the easiest way to just,
Mhm.
if you wanted to kick in some support, that would be the place to go.
Yeah. Excellent. All right. Well, we'll make sure that that's in the description below, so anybody who wants to support your work can get there really easily. Thank you for joining us today, Nathan. I really appreciate what you're doing at Kopi. I think it is really true that we need to focus on mental health and take a holistic approach. So I appreciate that you're doing that, and I like the mentality of making yourself obsolete and really trying to pass the baton as the end goal. Without losing sight of what matters and making sure that it's set up really strong so that you could essentially, it might not be, in the next 10 years, but at some point that you could walk away and know that what you built is still going to stand. So thank you for joining us. I really appreciate it.
Yeah, thank you for having me. It was wonderful to talk to you, Sasha. Thanks.
Thank you. Well, keep up the good work.
All right, you too.
Thanks. Here at Emanate International, it is our mission to promote nonprofits and social enterprises that equip individuals and communities to become independent, autonomous, thriving members of society. Indeed, Kopi Medical is certainly doing great work to support medical and mental health care for people in Tanzania in a dignified and sustainable way. If you enjoyed our discussion today, please be sure to hit the subscribe button and the notification bell to be in the know for future inspirational conversations with other leaders who are making great gains in improving our world. Thank you.